suffering plays such a prominent role in the Church's understanding of health and salvation, and that even though I was trained as a surgeon early in my career, and I practiced surgery for many years, becoming Orthodox, I realized I had to rethink the whole approach to medicine. One of the major changes in my own professional life as a physician came about as both my wife and I learned more about the Orthodox faith and realized that suffering plays such a prominent role in the Church's understanding of health and salvation, and that even though I was trained as a surgeon early in my career, and I practiced surgery for many years, becoming Orthodox, I realized I had to rethink the whole approach to medicine. The admonition or the spiritual call to remember our death is something that's there in the Western form of Christianity, but it's largely been forgotten, and yet it's very prominent in the Orthodox experience for the person coming out of the West into the East. And I needed to understand this so I could rethink about my medical practice. And so even though I was focused on curing diseases, surgeons are particularly interested in intervening and fixing things, I realized that all of my patients would die. And the question is it possible that there could be something beyond cure? And of course, the Orthodox answer to this is that yes, there's healing, and the healing eventually reaches its consummation in our death and how we die. And so, not in some morbid way, but fundamentally our approach to death, our preparation for death, our whole life is a preparation for death, for the encounter with Christ at the moment of our death. That is something that is so precious that if I can ease the pain, the physical pain, or other distressing symptoms of someone with advanced cancer or some other illness, so that they can be clear in their mind to pray, to engage with their spiritual struggle, that's something that I can offer them, and also offer, make an offering to God. And so I kind of moved away from my curative approach, although I continued to practice surgery for several years after obtaining training in palliative care. But I tried to do the two together and blend them, and then began to work as a volunteer physician and educator in places outside the United States, primarily in contexts where there were Orthodox traditions. And was able to kind of see this integration between the care of people who are suffering, no longer being concerned about whether an illness is being cured, and not being concerned so much about the longevity of the encounter. In other words, if I had some of the most profound encounters I've had with patients, spiritual encounters with them, when they were literally on their deathbed and maybe died within 24 hours of the encounter. And so where Christ says in the gospel, even a glass of or a cup of water offered in my name will be remembered in the kingdom, I've experienced that in ways that I maybe intellectually could encounter it before and sort of say, yes, that's true. But I realized that perhaps whatever kind word or attention that giving my full attention to someone when they're desperately needing someone to hear them, was more important than some elaborate operation that I might have performed on them. I maybe even did perform on the same person earlier in my caring for them. So this sort of turned my whole medical world upside down, and thank God.